Hello and good afternoon. Welcome to this afternoon session at the COVID Communication Center. Today the panel will have representatives from one of the most important role players in Namibia's fight against COVID-19. We will be joined by Health Ministry Executive Director Ben Nangombe, and he will be speaking with Thomas Mbeli, the Ministry's Acting Director of Health Technology and Infrastructure Management. They will be discussing or giving us an update on the Ministry's preparedness for COVID-19.
Good afternoon, fellow Namibian. Welcome to the COVID-19 Communication Center. This is our afternoon session at 4 o'clock. Today, this is actually a one-stop communication center that brings you updates and latest development on COVID-19 pandemic in Namibia. Today, we are speaking about the health infrastructure development, on how prepared are they and how the Ministry of Health and Social Services is ready and prepared in terms of infrastructure to actually tackle the pandemic, COVID-19 pandemic here in Namibia. Today in the studio, I'm joined by Mr. Thomas Mbeli. He's the acting director of infrastructure technology and health management in the Ministry of Health and Social Services. And I'm joined by Mr. Ben Nangombe. He's the executive director in the Ministry of Health and Social Services. We would like to welcome you all as our panelists today. With no further ado, I would like to ask, as I said, today is more on looking at how the health infrastructure in our country is ready and actually how prepared we are to continue fighting the pandemic in Namibia. Maybe the first question I would like to pose to Mr. Nangombe. Mr. Nangombe, in terms of infrastructure development, the infrastructure that we have in place now, how prepared we are?
Yeah, thank you very much for the question. And again, we are pleased to be here to share information with members of the public in terms of the ongoing COVID effort. I think to start with, if we are asking how ready we are as a country, that is a broader question that must be related to the setup of our public health infrastructure in general. And I want to start by saying that despite challenges that Namibia faces, we still have one of the best public health systems in Africa, comparable to any other. And I want to say that at the moment, we are talking about a public health infrastructure where we have one main referral hospital, 3 intermediate hospitals, 31 district hospitals, 43 health centers, and 279 clinics spread over this large country called Namibia. So that is the basis from where we are starting. Now, when it comes now to the looking at the preparedness for COVID directly, we are using this existing public health infrastructure, but we are adding new segments, such as the isolation facilities that we are building, treatment centers that we are building, and so forth. You remember that we, for example, have an isolation center at the Windhoek International Airport, a military hospital has been put up there. And we have various other isolation facilities, particularly for infectious diseases, in places like Zambezi at Katimamrilo, at Ngela, we are building one at Rundu, and so forth. I want to tell you that, for example, the Windhoek Central Hospital casualty has been renovated to become an ICU facility for specifically infectious diseases, and that has been finalized. We have constructed a 12-bed facility, also near the Central Hospital, again to take care of COVID, which is also ready for use. It's only awaiting the installation of medical gases to serve also as an ICU, but it can accommodate mild cases. We have built other facilities as well, including what we are going to do with the TB ward in Katutura Hospital, also to be converted into a 52-bed isolation facility, of which 11 are going to be ICU beds. We have awarded bids already to construct isolation facilities at Opuo, at Oshakati, at Rundu, and so forth. So we have also awarded bids for the construction of isolation facilities at Hobabes and Kietmans. So those are going to be awarded as well. So generally, I think Namibia is ready. We have a public health system that is ready to accommodate what is coming, if it is going to come at all. So we can comfortably say that the nation must rest assured that the facilities that we have and which we are going to put in place will be able to respond adequately to what is coming.
Okay, thank you very much. Mr. Mberi, Mr. Nangobe actually gave us an overview on how prepared we are in terms of our health facility, the number that we have and how ready we are to fight this pandemic. I wanted us to look more deeper into let's take commerce out and look more into the regions in case should we have community transmission where we have the virus spreading across regions in Namibia. How is the setup of isolation unit going so far in the regions?
No, thank you, and once again we are pleased to be here to inform the nation. With regard to the question is that first of all we have to look in terms of international health regulations of 2005. Where we need to have capabilities to do surveillance of disease outbreaks, as well as to respond accordingly. And the response is obviously dependent on a resilient health system. Now, resilience of a health system has got quite a number of components. That is your human resources, your pharmaceuticals, the information management systems, and most of all the infrastructure development in which services are to be provided. Now, taking commerce apart, for which my ED has alluded to, is that at the 31 district hospitals and the 3 referral hospitals, which are not Windhoek-based, is that we have made specific reservations for isolation beds at each and every of those hospitals. And what we have done is that in terms of the accessibility to other neighboring states, where we have done isolation facility, in particular for Engela Hospital, we have done for Rundu Hospital, we have done for Katima, and Oshana. We are then therefore going to Opuo to do a specific isolation facilities as, although we have isolation beds, we need to make provision for the eventuality. Similarly, we have been working with our regional offices, in particular the Kavango East and Kavango West regions, looking at availing facilities, in particular in the Andara district. So we are now working in terms of what we call a malaria camp, where we do malaria testing and epidemiology of malaria. We've got quite a number of bungalows which can be converted into isolation facilities. Similarly, we're also looking at Nyangana Hospital to rather have those isolation facilities compatible to be able to treat patients who are affected or infected. Because what we are saying is government has a two-pronged approach in terms of isolation of those who are infected, as well as quarantining people, those who are exposed or have been exposed to the COVID-19. So we've fairly gone out to make sure that we can respond at all our district hospitals. We are not only referring to the far northern belt, but we're also doing similarly at Marintal in consultation with the Ministry of sport, using the Kikanahab Youth Center, and obviously then looking at how do we upgrade Keetmanshoop Hospital to have additional isolation facilities for the whole of Karas. But obviously, we are also then in collaboration with our partners, as well as the regional councils, in terms of our preparedness for isolation facilities, as well as quarantine facilities.
Okay, thank you very much. Maybe just a follow-up question. Transport is very key as far as infrastructure is concerned. As a country, when we are fighting for this pandemic, of course, we need to ensure that our ambulances or our vehicle at our health facility are actually serviced and up and running. Can you talk us through that? How is our transport? Are they ready? Our vehicles ready? Our ambulance up to date?
No, that's a good question. Transport is a backbone to our referral system. In the current situation where we are, we have made use of our current fleet, as well as we are getting some other support from other stakeholders. Then the issue is that in terms of response for COVID-19, because these vehicles can only be used for the COVID-19 response until we have gone through that phase and that disinfectant has been done. Obviously, it has partly impacted in terms of our referral systems, but we've, as a country, we have also looked at that we do not do elective surgery at the current environment where we are, and thus, so these discussions and the strategies are complementing each other to ensure that we have available transport to refer patients. But obviously, our biggest strategy is to minimize movement.
Okay.
From facility to facility.
Okay. Thank you very much. Mr. Nangombe, I want us to talk us...
Just add to one issue that my colleague referred to.
Yes.
And that is to say that when we look at the capacity of a country or the health capacity of a country, we mentioned the issue of infrastructure. But again, we also mentioned the question of human resources. Yeah, and I want to emphasize that with respect to COVID response, the ministry has prepared a costed plan for COVID. And in that costed plan, we have indicated that we need to recruit about 2,605 health professionals.
Yes.
And I want to add that as of today, we have recruited already 1,053. And our target date that was set was that by June 20th, we should have recruited the number that we require. So we are talking about infrastructure, we are talking about transport, but of course at the back of it all and at the center of it all is to ensure that we have sufficient human resources. And the 2,605 that I'm talking about, this is additional to the existing capacity within the ministry. And again, we are also saying that it's not also only public health workers that are responding to COVID. We have the private sector also coming on board, and we count on them to support this effort. So I wanted to just bring to the head the centrality of human resources in this particular effort.
Okay, thank you very much, sir. Maybe the other follow-up questions, I wanted to look at the health community workers. These are very important people that professionals that we actually need to have in place. How prepared are they? How prepared is the ministry actually to ensure that these people are in the field and they are actually ready to respond to the cases should they start arising in the regions?
It's all about capacity building, it's all about training, it's all about preparedness. And among the 1,053 that we have recruited is a number of health workers. If I remember correctly, there are about 263 or so among the number that we have recruited already. And they will be capacitated in terms of training, how to conduct themselves, how to go out and do active case search, and all these issues. Because we are saying that in order to get broader data that is going to help inform the decisions going forward, we need to find more and more cases. And it is the community health workers, among others, that are going to go out in the communities to provide the necessary public education and to refer patients that may perhaps require to be screened and tested for COVID. So they are a very important component in this particular effort.
Okay. The other question that I wanted to pose to you, Mr. Mberi, is the question on our quarantine facility. And I understand there's a large number of Namibians that are still under quarantine. You know, maybe just talk us through how in what are these facilities in conducive environment? Should those of our people that are under quarantine now, what kind of support are they getting during this time when they are actually in this living now in this facility?
All right, thank you very much. What we are saying is that we still need to clarify what is the definition of quarantine. Where we are saying it's a separation of persons who are not ill, but who may be exposed to infectious agents or disease. Now, quarantine facilities can be for a multiple of things. It can be hotels, dormitories, facilities with catering areas. And it's that areas that we as the ministry and with our stakeholders have consulted across the board throughout the country to identify facilities which are conducive for quarantining. So it can be a hotel, it can be a boutique, and obviously it can be the NWR facilities which we have been putting people in. But we have to make them conducive as much as possible to those persons as well as to our own health personnel who are being availed into those facilities.
Thank you very much. Mr.
Let me
Nangombe?
just add, you asked about what kind of support are the people in quarantine getting? And that again is important to emphasize. Quarantine in itself is an act that can have psychological effect on an affected person. So it's for that reason that the minister has made sure that psychosocial support is provided for persons that are subjected to quarantine. And the message that we are trying to really deliver to the persons that are in quarantine and to the public in general is that we are encouraging people to embrace the quarantine concept because it helps us and it helps them to protect themselves, to protect the public. Because if we do not do what is required, if, for example, we had not done quarantine and closure of the borders and lockdown and all that, it may be that we would be at a different place today than what we are. The first case, the test came out, the positive test came out on the 14th of March. And up to about the 6th of April there, the cases were going up. We are now seeing a situation where the curve has plateaued. We are not saying it has necessarily curved down, but there is a plateau on it. And for the past 19 days, there has been no new case reported. We would want to believe that this is in part a result of the measures that the government has put in place. And that also includes now psychosocial support for the people who are in quarantine to ensure that they embrace the concept, they accept it, and they see it as a measure to protect themselves, their families, their communities, and the country at large.
Okay. Do you want to add something there? Okay. Maybe another question that I want to ask is a question Mr. Nangombe, you actually alluded to the fact that we have increased the number in terms of recruitment of our health professional. The question is, how are we ensuring that they are protected?
Yes, again, I have said it and I'm going to say it again, that our health workers are the tip of the spear. The frontline workers are the tip of the spear in this war, because we are on a war footing against an invisible enemy. And it's the commitment not only of the ministry, but of the government to ensure that our health workers are properly protected, that their families are also properly protected. It's for that reason, for example, the individuals who are allocated to work either with active positive cases or those that are in facilities, screening facilities, we do not allow them to go home. We provide a facility for them where they stay for the period of that activity, so that their families are protected. But at a personal level, with respect to the health workers, we are ensuring that they get the personal protective equipment which they need to do their work safely. And this must go hand in hand again with something that has been stated before, that yes, as much as we are making sure that our health workers are protected, we need to emphasize the need for the rational use of protective equipment. Personal protective equipment are context specific. And each and every circumstance dictate the kind of personal protective equipment that you need. And we have ongoing training programs to train our people how to fit themselves with these things, how to utilize them to ensure that they are safe at all times. And that is something that is ongoing as we address this particular pandemic.
Okay.
Just
okay,
maybe
you want
to
to add
add
something, sir?
to add something on protection of health workers. Now, in terms of health facilities themselves,
Yes.
in terms of design and layout, there is also a need to look at infection protocols. And this is what the ministry has been attending to in terms of its development of isolation facilities, as well as in consultation of all other stakeholders who are assisting government in the construction of isolation facilities. Because there's a definite need for a green zone inside the facility where health workers can move. They can don on the PPEs, the protective equipment, and then go work in a red zone where then the infected are, so that there is not that cross-infection. So I just wanted to make that clear in terms of design layout of health facilities.
Okay, all right. Maybe the follow-up action, Mr. Mbeli, I wanted to ask about the infrastructure. When we are talking about infrastructure development, the other component that we need to speak is an issue of water at our health facility. Those health facilities that we have in our country that don't have, enough access to, to water. Either it can be in a form of a water tank or a tap there. What are we doing? What is the ministry doing this time to ensure that these health facilities are equipped with water, which is actually a very important aspect of the fight of the pandemic?
No, thank you. Water is very, very important for any hygiene and for us to avert COVID-19 as well as Hep E. What we have been working in terms of any infrastructure development is to work with our regional councils. For there where there is no fresh water supply, for example, your NAM waters, then we engage with the various regional council and the Ministry of Agriculture in the provision of boreholes. So that has always been our coordination, and that we ensure that water is available at all our facilities. Obviously, there are facilities in local authorities with the new regulation which has been passed. Fortunately, some of our own government facilities can pass through the test to be provided for the free water. But obviously, that bill is still to come to us at the end of the situation. But what we have done in terms of the large hospitals is that we have ensured that there is backup water tankers that can at least provide water for at least 24 hours.
Okay.
In case there is any disruption due to the maintenance of water lines or anything of that certain nature.
Yes.
Yeah, perhaps if I can just add that it's not only water, it's utilities in general, including electricity. And as an accounting officer, I have instructed my officials to ensure that the payment of water and electricity for our health facilities is a top priority. And that is how we have been operating to ensure that we have water available at health facilities. And I just want to add, and I think Tom can back me up on this, to say that I want to believe that all our public health facilities, including clinics, It's perhaps the outreach points that may not have water, but we, I think, have water supply available at all public health facilities in this country. And that is what government has done to ensure that our health facilities operate in a manner that is safe for the patients and is conducive for the provision of quality public health care. So water is important, and we have made it a point in the ministry that we prioritize the availability of utilities at our health facilities.
Okay. Another question that I want to pose is, I understand during the beginning of this week, the ministry has actually kicked out or rolled out the mass testing campaign. This is another call to the infrastructure development component in the ministry, that they need to step up, and actually attend and assist during the rollout of this campaign. Is this mass testing only happening in Windhoek, or there are plans for it to be actually expanded to other regions?
Yeah, we are saying that in order to have evidence-based decision-making, you need to have data. It's all about data.
Yes.
And for you to have the data, you need to collect that data, interpret that data, and then apply the solutions that you are getting from out of that data. So we have seen that, for example, there has been talk that Namibia is not testing enough. Yeah, it is for that reason that when the lockdown was declared, for example, for Erongo and Commerce, the idea was also to speed up or to upscale testing. And we have done exactly that. To date, we have tested about 590 persons in Namibia. We have done a retest of about over 50 times already. And the retests are necessary to determine whether those that have been infected are in fact recovering and shedding the virus and therefore becoming negative. And if they test negative twice at intervals of 48 hours, they are declared as having recovered. So the ministry is working very hard, and in fact we have already completed the concept note on upscaling and expanding testing. We have identified the target groups that are going to be tested in order to get that critical mass of data that we need. So, and already I believe yesterday here, some of the journalists were already tested. I read something in the paper today that this has started to happen. So we are looking at specific categories of people that we are going to test, including those that are presenting at our health facilities with respiratory ailments. We are looking at workers in the mining sector, in the fishing sector. We are looking at health workers and other categories. Again, this is the means to get the data that we need to inform the decisions going forward as far as the lockdown is concerned. And this is going to happen in other parts of the country. So our laboratory testing capacity with the NIP has been expanded. We are doing more and more tests, and we have set a target going forward over the state of emergency period. So that is what is happening, and our health professionals are ready to embark upon this important exercise for the country.
All right. Mr. Mberi, do you want to add something on that? All right. The other question that I wanted to pose is the issue of, again, I wanted to speak to our health worker. This is a very important group of professionals that we need more during this time. I wanted to look at, should they get sick? I understand we have quarantine facilities that are in place. Do we have a specific place for them where they can be taken care of?
Health workers, should they get sick, will be treated like other members of the Namibian public. We do not discriminate. We will not give special treatment to any one person. So the quality of care that we are going to give to anybody who gets sick is the quality of care that we are going to give to our health workers. And that means giving them the best care that is available, that we are able to provide in our public health care services or elsewhere should it become necessary. Because as you know, we have had instances where an individual gets sick. Perhaps they need specialized care that may not be available in the public health sector. We refer them elsewhere. Because as much as the public health sector is sophisticated and we do have services that are available to serve our country, there are other procedures perhaps that we may not be able to do within the public health setting. So we have partnerships with other facilities in order to support the public health care system. That is why, for example, the government has put in place the special fund for uncommon illnesses. And that fund takes care of very complicated conditions that cannot be conducted in the public health sector. And that is normal. You cannot claim to have all the capacities that are available out there in the health industry. So for that reason, wherever necessary, that opportunity is available to take care of our people whenever it is required. And this is available to any Namibian for that matter.
Okay. Just for a public viewer, I just want to inform you that our call-in line is open. The number is 061 400 397. 061 400 397. We have Shapumba on the line. Shapumba, good afternoon.
Good afternoon, sir.
Yes, I'm good. How are you?
I'm doing good. Just a question to the health director.
Yes.
Since now, if we are approaching the winter time, and winter is where now we are normally attacked by those flus and fever and all that weather. I want to understand from the ministry that how their preparation when it comes to the mobile clinic, since there are some restriction of movement in the public. Do they have mobile clinics so that they can maybe attend to the citizen if I feel like need some Panados and all those things, so that we limit ourselves the movement to go and maybe to go to the clinic and hospital?
Mr. Nagombe, did you get the question?
Yes.
Did you get the question?
Yes.
All right, thank you very much.
I believe the question is whether the ministry
okay, you can just continue.
would be able to provide mobile services due to the fact that there is a restriction of movement. Yeah, it's a very, very good suggestion. Yes, we do have mobile clinics. We have something called outreach services that also goes out where members of the health profession, public health profession, go out in the public to attend to people, particularly those that do not have easy access to public health care services. So that is there. So I welcome the proposition that perhaps we need to broaden this, particularly in the context of the limited movements of people. But on the other hand, you will also remember, for example, that in order to, again, improve access, particularly here in Windhoek, we have opened the Katutura Health Center to be able to operate for 24 hours. That is another way of expanding access, possibility of access to health care. So, but I think that we could possibly consider the mode of providing healthcare by mobile means. It is something that is worth considering, yes.
Oh, interesting. In absence of a caller, the other question what I wanted to pose here is the question of public education. Public rolling out public campaign on information related to COVID-19. How, in terms of progress, how is the ministry actually doing?
Well, in the National COVID Response and Management Team, you have a theme group for risk communication and community engagement. And it is through that group that messages for public education are being developed. Materials for public education are being developed. Interaction with the media is taking place. So, for example, when you see messages being flighted on the television or on the radio, particularly the radio, because the radio is really the medium that reaches the majority of our people. It is under that context that we are working to educate the public. We also want to make sure that community leaders, traditional leaders are also brought on board in order to again spread the message of the importance of adherence to the measures that we put in place. We want the nation to understand that these measures are not put in place because the government wants to restrict the movement of people for the sake of it. There is a greater objective behind the measures that are being put in place.
Mr. Nangombe, let me just interrupt you now. For now, we have a call on the line. Rosaria, good afternoon. Good afternoon, Rosaria.
Yes, good afternoon.
Yes, may you, how are you?
Fine, thanks. How are you?
May you please pose your question?
Okay, thank you. So I have a question to Mr. Nangombe. So he talked of recruiting more professions. So my question to him is, what process are they using to recruit these people? So are they advertising posts, or what process are they using? Because we have some graduates who are sitting at home, so but they don't see those posts being advertised. And he talked of like they have to be finished with the recruiting process by the 20th June. So how are they, what process are they using exactly to recruit these professions?
Thank you very much, Rosaria.
Thank you.
Yeah, thank you very much for that question. With health professionals, we do have databases of all qualified health professionals. We also have applications that have been submitted already to the ministry by unemployed health graduates. We have a database, for example, of our health extension workers. So we go into those databases and we pull those applications, and they are assessed as to their suitability. So this is an accelerated type of recruitment process, but if there is anybody out there who has got a qualification in the health sector of one qualification or the other, we have the toll-free number that is available that people can call in, and they can submit their information for the ministry, to the ministry for consideration.
Okay, we have another caller, Adolf. Adolf, good afternoon.
Yes, sir, how are you?
Yes, I'm good. How are you?
I'm doing fine. I want to ask something from Mr. Nangombe. It's concerning about the alcohol. I heard people have been allowed to sell alcohol of the 3% of the alcohol content. So my question is, if somebody is to be tested alcohol in the blood, so say for instance I consume 4 cans of the
Adolf, we cannot hear you. Can you speak a little bit louder?
I think there's a radio in the background.
Okay. I want to put a question.
Unfortunately, we have to cut you off. We can't hear you.
Okay, sorry.
All right. Yes, Mr. Nangombe, we're speaking to the issue of public education. Maybe just to take you back to that question.
Yes, we are saying that we want the nation to understand that the disease is real and it is here. And we have seen, I'll tell you that most people around the world have seen how devastating the disease can be. So what we are saying is we want all Namibians to approach this disease in unity by complying with the conditions that have been put in place. That is the only way we can protect ourselves, is the only way that we can protect our country. And we are saying that the messages must be strengthened through the media, through the radio, by publication of pamphlets, and so forth and so forth. And I'm glad that even artists have approached the ministry to be able to contribute to this effort. Again, and also the question of the toll-free numbers that are there, the 0800 100 100 number, the 911 number, these are platforms that are put in place to enable Namibians to receive accurate information. And on the question of also public education, we are saying that it is important for the members of the public to rely that they should get authenticated information from authenticated sources, such as this particular platform. This media center was opened specifically to be a platform where ministry officials, technical officials, and others can provide information to the public, which is authentic information, because we know there is as much as we have a pandemic, there is an infodemic of misinformation out there. And we need to combat that infodemic as aggressively as we must in order to ensure that our people get only authenticated information that is able to educate them. We are glad that companies like MTC, for example, is sending information through cell phones to educate the public, to encourage them to stay home. So it's all this information. And we are also saying that as much as there is a need for people to stay home, again, those that, for example, have to go out in order to exercise and to do whatever, to be physically active, that is encouraged because it's important for your physical health and also your mental health. So these are all the things that must go hand in hand in order to ensure that the lockdown or the restriction of movement does not have negative consequences for the people, for them to become depressed or whatever. So all these things must go hand in hand and they must work together, but it is important, of course, as you say, to educate the public of what information is out there.
All right. To our media practitioner in here at the center today, actually, if you have any question, just to come to the podium and pose your question. Yes. And to that, we have Maggie on the line.
Hello. Hello.
Just hold on. Just hold on there, ma'am. Yes, Maggie?
Yes.
Yes, Maggie, can you quickly pose your question?
Can you hear me? Yes, I just wanted to bring it up. I think people at the villages, either they are not taking this thing serious or they do not understand the current situation. Because recently, if you call even your farm worker, he will actually go on and ask what is COVID-19 or what is corona disease.
Can I interrupt you? Can you please speak louder and ask your question? What is your question, Maggie? Please speak louder as well.
My question is, are the people in the Omaheke region going to the villages to talk to our elderly people? Do people there outside know what is happening? Because why I'm asking this is I recently called, but people seem not to have the right information or the full information.
Okay. All right.
That's basically what I wanted to bring to your attention.
Okay, Maggie, Mr. Nangombe, to Mr. Mbedi, the question is the people in the Omaheke region, according to Maggie, they are not informed on COVID-19. They don't know what is it. Ma'am, can you pose your question before we move on to that, to the response of Maggie? Yes, please. The opportunity is yours.
Thank you. Hi, Mr. Mbele, Mr. Nangombe. Yana Marie Smith from Namibia Media Holdings. I have more than one question, I hope that's okay. Regarding the mass testing, at the moment I believe the testing is still less than 20 a day. Could you say what the plans are to increase daily testing, and by what time day you're going to reach the maximum capacity to test per day? I've also been asked to inquire about the critical medical supplies, such as oxygen provision in hospitals. Is there enough oxygen, or could it become problematic? And are staff trained in when to use and how to use oxygen tanks, I believe?
Yes, we are just giving you two questions. I believe that was the second one.
Yes.
All right. To our panelists, may we please attend to the question?
Yeah, I'll take the first two. And Tom will talk about the oxygen supply. All right. Yeah, all the regions in the country, at least when I say regions, I'm talking about the regional health directorates, because we have directorates of health in all the regions, are primed to combat this COVID-19 virus. And saying that is that at the regional level, there are consultations going on between various stakeholders as part of the response. So it is important to ensure that they go out and they spread the message about COVID and about health in general. Because I also want to add that the challenges within the public health sector that were there all the time before COVID are still there. So our work does not start and end with COVID. We are still engaging in terms of providing public health services as we have done since day one. So again, that must be important. So if there is a concern in Omaheke, particularly that the regional health team or the regional response team is not spreading the message or talking to the elderly people, we will look into that and encourage them to do what they must. But I am in touch. I have spoken to Mr. Shikulo more than twice since the outbreak started. We have engaged in discussions to just hear how the region is doing in terms of their response. And he has indicated that things appear to be on track. So, but if there is a response or rather a concern about one specific issue, that is something that we can look into. Yeah, so, and this is applicable not only to Omaheke, but all other regions. And I can tell you that I am in touch with many of my directors at least once a week. So that is where how we are interacting and supporting and providing support to the regions. Yeah, so with respect to testing, I don't think it is accurate to say that we are testing only on average of 20. We are definitely testing more than that. And as I indicated, we have completed the concept paper on expanding testing. And this is a document that is going to guide us going forward in terms of how many numbers we are going to test per day and by when we are going to do that kind of testing. So this document has been worked on our professionals using the models based on the disease projection model, using information on the attack rate that a country may experience. So we are on top of the issues as far as that particular concern is concerned. So we are testing more than that. We have a concept that has been completed and is going to guide the rollout of expanded testing going forward.
Okay. Mr. Nangombe, can I just give the journalist on the floor to come and ask their question?
Can answer the question on the critical medicine.
Yes. Let's just give
the oxygen issue.
Okay. We'll just give an opportunity to pose a question and then we'll take it from there.
All right.
Good afternoon. My name is Selima from NBC. I have one question for Mr. Nangobe and then I have two for Mr. Thomas. My first question is if the ED can perhaps just update the nation again about where we are with COVID-19 cases, because there is a rumor that there is a case that has been confirmed. And also my other two questions directed to Mr. Thomas. If you can briefly just tell us some of the lessons that the Ministry of Health have learned so far in terms of health infrastructure in the country from COVID-19. And also just to find out, although we talk about being ready in terms of health infrastructure in the country, are the infrastructures adequate? Thank you.
All right. To our panelists, may we just quickly attend to those questions? Briefly.
No, thank you very much for those questions. The issue of medical supply and lessons learned on infrastructure, I think I'll take those two together. In terms of the 35 public hospitals which we have, all of them have a connection to the medical gas bank, which provides for oxygens at various outlets in the various wards, theaters, and ICUs. Obviously, there are some sections in our hospitals which do not have oxygen points. Because in terms of treatment of COVID cases, there are three categories. There's mild, which doesn't need any inpatients. There is the severe, which will need some oxygen, and critical patients which need ventilations, mechanical ventilation. So in terms of the response and in terms of the lessons learned, is the improvement of our facilities to have medical gas network points in order to provide for the necessary oxygen which may be required, be either for infectious diseases or for any other diseases going forward. That's very important. The other issue on oxygen, although we don't have oxygen in some of those wards, we make use of the oxygen bottles. Obviously, it is a costly exercise in replenishing the oxygen bottles, but I think these are the lessons we are learning, and going forward, how do we improve our infrastructure for the provision of medical gas network points. The other important aspect is the distribution of isolation facilities in the whole country. Because currently we have only looked more at points of entry, because we have more vulnerability at those specific areas. So we first then need to interrogate and do our strategic planning of all other entry points, as well as other crucial points where we think there is a need to really be ready for any response of any emergencies. Thank you.
All right, Mr. Nangombe, maybe can you just attend to those
Yes,
responses? And with those responses, just give us your final remark as well.
The number of cases. Again, we are saying that the number of cases that has been reported as positive in Namibia so far stand at 16. And the last case was reported, I think, on the 5th of April, if I'm not wrong. And from the 5th of April, for the past 19 or so days, we have not had any other positive case. However, we are doing retesting. So there are instances where we have about 2 or so cases that keeps returning negative. But this is a retesting of the already known positive cases. So they are not new cases. So if perhaps somebody got access to data showing a positive case, it's only the positive cases that are being retested. So for now, we stand at 16 cases positive, and we are doing testing going forward. And of course, as we have said, and we have said it again and again, we are going to inform the nation whenever there is new developments in this area. But we are happy that at the moment, there seems to be a plateau on the curve, and it's going to be informed by the ongoing and expanded testing that we are going to conduct in the coming months.
Thank you very much. Just maybe your final remark, Mr. Mberi, before we move on.
I think in terms of my final remark is that we as a nation need to adhere to the regulations which have been put in place in order for us as a country to protect ourselves. We really need to keep ourselves to those regulations. Thank you.
Thank you very much. Yes, Namibia, that's all what we have today, as we were really discussing and looking into the preparedness of actually the Ministry of Health as far as the infrastructure development is concerned. So tomorrow we'll be looking at the impact of COVID-19 on the art, culture and music industry. So join us tomorrow. That's all we have today. Thank you very much.
B-Linie. Ja. Thank you very much. That concludes the afternoon session with Mr. Nangombe and Mbeli from the Ministry of Health, who spoke about the infrastructure preparedness of the ministry, saying they feel they are in good shape, but also saying that they are learning very valuable lessons in terms of infrastructure for future health issues in Namibia. Thank you.